Last class we are discussing regarding the shock. Can you tell me the definition of shock? Define shock.
That don't have the regular cellular functions.
Repeat please.
So shock is defined as a state of the reduced tissue perfusion that will have the normal cellular functions.
Why you are telling that hamper? Hello.
Shock is the extent of low tissue perfusion that is inadequate to maintain the normal function of the body.
Bas একই কথা. You need 2000 rupees per month for your expenditure. If your guardian supplies 1000 rupee per month, would you be able to complete your normal expenditure? No. Then what will happen? Your all movement should be curtailed like this. Tissue has a limited fixed demand of oxygen. If there is any shortage of oxygen, then the cellular functions, the the normal function, that function should be hampered, or that would be inadequate to maintain the normal function. If you get rupee 1000 instead of 2000, then you will not be able to perform your all expenditures. Okay, like this. Thank you. Sit down. Now, regarding the types of shock, we have mentioned that there is a hypovolemic shock, তারপরে distributic shock, আর কি what are the types of shock বলো? Okay, there's the 5 types of shock. Probably we have discussed how the hypovolemic shock occurs. Is it so?
Yes, sir.
Cardiogenic shock, it is also discussed.
Yes, sir.
Obstructive shock.
Yes, sir.
As the name indicated, definitely there should be an obstruction of blood flow. So, where should be the obstruction? If there is a cardiac tamponade, if there is pulmonary embolism, if there is tension pneumothorax, and if there is air embolism, they are the 4 conditions when heart become unable to pump adequate blood. Okay, every organ is fine, but there is existing 4 conditions. That is why heart is unable to pump adequately. As a result, there will be less blood to your peripheral tissue, and when there is less blood, there will be less oxygen to your peripheral tissue, and then the want of oxygen tissue will undergo anaerobic organism, that is, there develops shock. Clear? And now you have to know what is cardiac tamponade. It is a disease process when you will be in 5th year. Yes? No. That is when you will be in 5th year, then it will be details regarding the cardiac tamponade. It is a cardiac disease. That is, heart is covered by a layer known as pericardium. And pericardium, and in between pericardium and heart there is a small portion of fluid. Okay, it is a normal. But when instead of this normal fluid, there become more fluid is accumulated between the heart and pericardium, then what will happen? The heart tries to pump, relax and contracts, but due to the fluid available in between the heart and pericardium, heart become unable to expand. And if unable to expand, then there will be less entry of blood inside the heart chamber. So when heart again contracts, there will be less blood pass out from the heart. Okay? So that is why when less blood is circulating in the circulation, then it happens the shock. Now regarding the pulmonary embolism, what is this? As we know what is embolism, and somewhere in the body there are formation of a embolus, and if this embolus circulating in the blood obstructs a bronchus, all blood from the body comes to the lungs for filtration, and this process one embolus blocks a bronchus. And what will happen when a bronchus is blocked? Then there will be no blood beyond this block. Clear? লাংসের যে সমস্তগুলো ব্রঙ্কোভাস্কুলার সেকশনগুলো আছে তোমাদের সেটা নিশ্চয়ই মনে আছে ফ্রম দি ফিজিওলজিক্যাল নলেজ। তো ইফ এ ব্রঙ্কাস বিকাম ব্লকড, then beyond the blockage there will be no blood, and if there is no blood then there will be no perfusion. It is not for all lung fields, but particular lung field একটা bronchus become obstructed due to emboli, and beyond this obstruction blood is not able to pass and is not able to perfused. So this blood returns again to circulation without having adequate oxygen. So that what will happen? This blood is circulating into the whole body. As a result, body will suffer from less oxygen, and certain tissue will react to it and they produces shock. Another one is tension pneumothorax. What is this? Same thing. Heart has got a covering layer, that is pericardium. Same thing in the lungs. Lungs has got covering layer, the pleura. Pleura has got two layers. One is visceral layer and is parietal layer. Parietal is attached to the inner side of the chest wall, and visceral layer is attached to the lung walls. In between them there is a fluid, and it constantly maintains a negative pressure which facilitates the inflation and deflation of lungs. Due to some abnormal conditions, when a sufficient blood or fluid become accumulated in between these two layers of the pleura, what will happen? The negative pressure inside the parietal and visceral layer of the pleura become lost, and the pressure will become positive, and then lungs will be unable to expand more. Chest wall যখন expand করছে, it pulls the lungs to become expand. But instead of negative pressure, when the pressure become positive, this traction effect is inadequate or less. That is why তখন due to the bucket handle movement of the chest wall, lungs is not be able to expand adequately. At the same time, it also exerts pressure over the lungs to not to expand. তোমার পকেটে যদি এখানে যদি তোমার থেকে থাকে, সে ধর আমার পকেটে একটা বক্স আছে, এখানে যদি দুইটা বক্স আমি গুজে দেই তাহলে কি হবে? একটা প্রেশার থাকবে আমার চেস্ট ওয়ালের প্রতি। ঠিক সেম থিং, যদি in between the two layers of the pleura, if there is accumulation of excess fluid, it will also exert pressure over the lungs to become expand. And due to the unability of the expand, lungs will be unable to perform the gaseous exchange. And inadequate gaseous exchange, the circulated blood contains more carbon dioxide and less oxygen. As a result, tissue will suffer from oxygen shortage and ultimately shock develops. Another condition is ear embolism. What is this? No, mention করছি ear embolism. Say one person is getting intravenous injection, and during this pushing of injection, someone introduces large amount of air, and this air will not be mixed up with your blood. It will be circulated in your blood as a embolus, and this may go to the when it go to the lung field, it may obstruct a bronchopulmonary segment, and as a result there should be the inadequate oxygenation. And this emboli may be iatrogenic, that is from the during the act of injection pushing it may introduced, or it may be produced inside your body. Whatever the source, there should be a portion of the air inside your circulatory blood. Okay, tahole these are the 4 conditions: cardiac tamponade, pulmonary embolism, tension pneumothorax, and air embolism, where there is inadequate oxygen, that is gaseous exchange in your lungs.